Yeah, good evening, Dewan, Bianca. First off, the numbers don't lie. Obesity is a real issue here in North Carolina, and it's one we're seeing impact those minority communities and poor North Carolinians the most. And that's a trend doctors say is concerning and is going to take real work and reform to correct.
Obesity is a huge problem in the United States in general, the South in particular, and North Carolina most of all.
Data gathered by University of Chicago researchers painting a grim portrait of the state of obesity both nationwide and here in North Carolina. Dr. John Buse is an expert on obesity and diabetes and says it's even worse for the state's most vulnerable populations.
Increased risk of homelessness, food insecurity, poor access to health care, and all of these are thought to be major contributors to the risk for developing overweight and obesity.
The numbers bearing that out. That UChicago study finding roughly 44% of North Carolinians live with obesity based on their body mass index. While roughly 41% of the state's white residents meet that threshold, it jumps to 54% for black North Carolinians. Obesity rates also 10 points higher for people with a GED degree or less compared to college grads. Buse hopes recent changes to the healthcare landscape here can help.
For a while, we didn't have the Medicaid expansion that many other states in the country did, but we do now. And hopefully people look into whether they can get coverage.
While also taking a closer look at some of the processed and refined foods that make up a large part of the American diet.
Communities are recognizing that the sort of food industrial complex is pushing stuff on us that is not very healthy.
Long-term, obesity can lead to heart disease, diabetes, and increased risk for cancer and arthritis. Buse says in places like rural North Carolina, much more can be done.
You might think that not wearing a seatbelt or smoking is the riskiest thing. In fact, the riskiest thing that you can do that's associated with healthcare outcomes is being poor.
Of course, replacing those processed foods and things like refined carbs and fats with produce and fresh meat can make a huge difference, but many folks simply don't have the access or resources to make those dietary changes, and that's where health experts say those community resources can really be helpful. We have more on that on abc11.com. Tonight, we're live in Raleigh. Sean Coffey, ABC 11 Eyewitness News.
Yeah, Sean, an important topic that deserves a lot of attention. Live for us again tonight. Thank you.